Good evening. My name is Dr. Eddie Yastrow. I'm a long-term member of North Shore Congregation in Israel, and I'm here tonight at the request of Rabbi Geffen and the other rabbis to speak to you about some of the challenging times that we're all dealing with. Specifically, the Rabbi asked me to talk about the challenges of COVID from the perspective of a healthcare provider, as a person who's lost a family member to this disease, and as a father and husband trying to navigate these challenging times. In addition, I'd like to share that I've been in a program of recovery for over 11 years, and the foundation of that program is a spiritual one, and it helps me to learn to live life on life's terms. In addition, the temple has graciously hosted an AA meeting on a weekly basis, and if anybody needs help or support for themselves or a loved one or somebody in the community, we're here for them as well. So COVID hit us, our country, pretty hard mid-March. My father-in-law was out in California and he got ill the second week of March, and we tried in vain to get him home to Chicago. He became sicker and sicker and ultimately went into the hospital. He was in the hospital for several days where he deteriorated. He went to the ICU and unfortunately passed away on the 21st of March. We realized from Chicago, due to the isolation, that there's very little control that we had over the outcome of things. We did try to remain grateful for the doctors who cared for him and the nurses who, especially the ICU nurses, who were involved in his care. One nurse in particular was a complete angel, and she did everything she could to bring my mother-in-law, my wife, my sister-in-law, and my children to his bedside through Zoom and through FaceTime. For me, it was a humbling experience to be on the family side of things rather than on the physician side of things. And I had to accept that there was very little going on that was within the control that I had. However, I did realize that little control over the situation did not mean no control over the situation. So to the best of my abilities, I tried to help explain things to my mother-in-law, my sister-in-law, my wife, my kids, and help the doctors as they made some very difficult decisions in caring for my father-in-law. Within a week or so, we were completely enmeshed in COVID back here in Chicago. As a physician with the North Shore University Health Systems, I was asked to help at Glenbrook Hospital, which became the COVID hospital, and we were completely swarmed with some of the sickest of the sick patients. Immediately, there was a lot of fear, there was a lot of fatigue, there was a lot of unknowns from a medical standpoint. Never in 30 years of practice in medicine have I seen anything quite like it. But it was really the principles of my recovery, the principles of my program that helped me cope and helped me move forward and hopefully offer some help to my patients, my co-workers, and my family. The sense of community amongst my co-workers was very strong and really necessary. We needed one another. We needed to ask for help in caring for patients. We needed to ask for help in caring for ourselves. We tried to help each other focus on the attitude of things rather than the circumstance. Try to remain positive. Try to remain progressive. I tried to remember to be grateful for the efforts made by my father-in-law's physicians and specifically the nurses. Many of my colleagues in anesthesia were asked to function as ICU nurses, and even though they hadn't functioned as ICU nurses for 10 years, they rose to the occasion and they took on the hardest jobs of all. And I wanted to make sure that they had the support from an emotional standpoint, a physical standpoint, and made sure that we communicated with them and helped them take care of these patients. Over the next several months, I tried to continue practicing these principles to the best of my ability. I relied on my friends and my family as a source of comfort and communication. I needed to talk about being tired, I needed to talk about being frustrated, and I needed to talk about being afraid. I made sure I didn't neglect my self-care by trying to eat well and exercising and listening to my body and getting rest when I needed it. I also try to find at least one thing a day to be grateful for. There was one day when I remember I was getting up, getting ready to go to work. It was going to be a long 12-hour shift. I was already tired. I was already kind of frustrated. And I was definitely feeling sorry for myself. So I tried to remember to be grateful for the fact that I would come home that day, that I would get to see my wife, that I would get to see my kids, my dogs. I would get to take a warm shower, and I would get to have a meal. My patients wouldn't be so fortunate. So by being grateful for what I had, I was able to change my perspective and focus on them and focus on their families rather than focus on feeling sorry for myself. Most importantly, how do I continue to cope with the fear of these times? Simply, I try to do the best of my abilities. I try to do the next right thing, and I call that the work. And then when that's said and done, I rely on the faith of my God or my higher power that this time will pass. My favorite quote, one of my favorite quotes is, "Faith without works is dead." So I do the work, and then I try to focus on faith. In order to focus on faith, I needed to surrender. I need to put my trust in faith. I need to learn to get out of my own way and to accept the really small amount of control I have in these times. COVID has been a perfect opportunity for me to accept that this is true. I have very little control, and I need to practice these principles in my program to the best of my ability. I'd like to share with you a quote and a reading from one of the books I read on a daily basis. And the quote goes like this: "If we were logical, the future would be bleak indeed. But we are more than logical. We are human beings, and we have faith, and we have hope, and we can work." And that's a quote from Jacques Cousteau, one of my childhood heroes. So what is faith? It is believing in possibilities. It is the ability to carry on with our plans or to be true to our work, even though we feel discouraged or tired. It is staying active in relationships, even when we receive little in return or when our friends aren't able to respond. If there were no doubt, there would be no need for faith. Faith is temporarily putting our doubts on the shelf and working toward our goals. Faith is trusting that help and support will be there for us, even though they're not in view. It's looking at a map and choosing a new destination, getting on the road to go there, and trusting the marks on the map symbolize a real place that we will find. I will leave room for my doubts and discouragement, but I will not indulge them. I will choose to go with hope. I will give my energy to the better possibilities. So I'm truly humbled to be speaking tonight and truly grateful for the opportunity. I don't consider myself to be a very religious person, but I've tried to evolve as a spiritual one who relinquishes control, in favor of faith, someone who tries to live life on life's terms and never forgets that life is a team sport. I can't do this without help from my higher power, love from my family and friends, and without continuing to do the work as I continue to progress and continue to learn and grow. I also believe that God has never given me more than I can handle, and that times of challenge ultimately become times of growth, although they don't often appear that way when I'm going through them. So thank you again to the rabbis and the members of the congregation for letting me speak tonight. I wish you all Shabbat Shalom and Shana Tova. Thank you.